Thanks, Melinda. Hello, everyone. Good morning. If you are in the US and joining us for this session today, my name is Rita Hymas. I am the General Counsel and Chief Privacy Officer at the International Association of Privacy Professionals, the IAPP. The IAPP is the world's largest privacy organization. We are a membership association for privacy pros who work all over the world. We have over 50,000 members globally. And you may have heard of our certifications like the CIPP US, CIPPE, and the CIPT, for example. So that's IAPP. So I'm glad to be here this morning, and this is definitely not about me. We have an incredible panel of folks who know a lot about privacy and privacy tech. So let's get into it. Before we do, I want to remind you this is a live event. We are taking questions and we'll try to address them as we go. So feel free to type a question into the Q&A. No guarantees we can get to all of them, and I understand there's a voting and ranking, so please participate in that, and we'll try to elevate the best questions to the top of the list for our panel today. So joining me in alphabetical order is Troy Bannister, who is founder and CEO of Particle Health. We have Jennifer Daskell, who's Faculty Director of Tech Law and Security at the Washington School of Law at American University. Dr. Rachel Hendricks-Stirrup, who is Health Policy Counsel with the Future of Privacy Forum, close friends of the IAPP, and Naomi Lefkowitz, Senior Privacy Policy Advisor at the Information Technology Lab with the National Institute of Standards and Technology, NIST. Thank you, all of you, for being here today. This conversation is really about some of the innovation in how to manage the COVID-19 pandemic by deploying technology so that we can learn more, share more, and communicate better, all of which is helpful to slowing the spread of the disease. But anytime you are gathering data and communicating it and sharing it, it always triggers privacy and security issues. And so we are balancing those priorities and trying to discuss how to do that in this conversation today. It's a very serious public health issue, and we're not trying to diminish that, but we have to admit that we get kind of excited by the technology and the innovation and even some of the privacy issues. So while we get worked up over the fun intellectual issues, I do want to make it clear that we appreciate that there's some very serious public and social issues that are associated with the pandemic. So how is the technology? How is the internet and healthcare communities, how are we all responding with useful tools, and what are the consequences of those tools? Is privacy by design, for example, making its way into the development of these tools, all of which has been done in a very rapid fashion? So I want to start by asking Jennifer to give us a quick overview of what contact tracing apps do and what the ways in which they collect and share data at a very high level. And then we'll turn next to Troy to ask about some other tech that maybe hasn't been developed in the last couple of months, like some of these apps have, to give us a framework for what's happening in sharing health data at this time. Jennifer.
Great. So thank you. Thanks to all the listeners out there, and thanks to the organizers for putting on this terrific conference and this really exciting panel. I'm really delighted to be part of it. So when we talk about the technology, there's lots of different aspects of this. And kind of at the core, public health officials have long talked about what people call TTTI, test, trace, treat, and isolate. And so the technology is being used in a variety of ways to both understand kind of the spread of the disease on an aggregate level. And then in particular, what I think we're going to be focusing on a lot today is individualized contact tracing. So I do want to just spend a moment separating out those two uses of technology, because I think they're very different and the differences matter. So, we've seen a range of different companies use aggregated data to do kind of mappings of movement. And these are things like using a range of data that's already in their possession, like data that's used for Google Maps or for iMaps that are used when we drive all the time. But companies have kind of rearranged and used that data to look at how people are congregating and moving about in the face, particularly in the face of some of the stay-at-home and lockdown orders that help assess congestion levels in particular places. That's one use of aggregated data, and we can talk a lot about, and I think we will talk a little bit more as we go on about the risks even associated with aggregated data. But then there's also efforts to focus on individuals and individual contact tracing. And that is really, you identify somebody who is sick and you try to figure out who that person has been in contact with. So that you can alert those other individuals, and those other individuals can take steps to both protect themselves and protect others. This is not new. This has been going on for hundreds of years. This was something that was done during the last pandemic over 100 years ago, only we didn't have cell phones then. We didn't have the technology we do now. And so with the technology, there's this hope, or at least this promise, that we can do a bunch of new and different things. We can supplement what are inherently faulty memories and supplement the really work-intensive process of doing all that contact tracing with technology. Now, there's all kinds of questions about, does that really work? And how to do so, and how to do so in both an effective and privacy protective way. There are a lot of different approaches that are being pursued and promised. One of the most talked about ones has been the Google-Apple system, which interestingly incorporates, and I think we'll talk about this a little more as we go on, what many people call some core principles of privacy by design. And I'll just kind of tick through a few of these and then we can delve more deeply into them. But it's opt-in. People have to actually activate something in order to use it. The data is held on individuals' phones, so it's a decentralized system. It does not involve government collection of data, and there's all kinds of reasons why that's more privacy protective than government collection of data. It uses Bluetooth as opposed to GPS or other forms of location technology, and that matters because the Bluetooth technology captures associations. So it's triggered when two phones are within sufficient proximity of each other without necessarily also capturing where somebody is at any given point in time. And again, we can talk about why that matters. And then other key aspects of this are what happens to the data once it's collected, and really important questions about limits on retention, limits on dissemination, and limits on access, all of which go into the questions about how privacy protective it is. On the flip side, the fact that this kind of system is opt-in almost inherently means that it's less effective. And that is because there's a range of studies that talk about the fact that you really need about 60% or more uptick within a given community in order to get the kind of returns on get the kind of information that's really useful. And we have seen, even in some of the countries that have the highest rate of use, I'm thinking in particular right now about Iceland, where there's an opt-in system and one of the highest rates of use in the world. And at least according to the last study I saw, the uptake there was about 40%. So huge challenges there when you're looking at communities at large. But even within that, it may be possible, and I think we'll talk about this as well, to have subsets of communities where the uptake is sufficiently high that these systems can be effective. So I will stop there. There's so much more to talk about, but I hope we can have a really robust discussion about all these issues.
Well, we will, and we aim to. Thank you for the very high level setup, and we will dive into some of those specific technical issues like Bluetooth versus GPS, and also the effectiveness of the tool as opposed to the privacy protections that may be built into them. So turning from the relatively recently developed and deployed app situation to maybe some tools and systems that have been around for a little bit longer than the apps. Troy, will you tell us a little bit about particle health, and also then maybe some of the data sharing systems that have been in place for a little bit longer than the Google Apple partnership and some of the other apps that have been developed by nations and even US states to try to share data during the pandemic? Go ahead, Troy.
Yeah. So first of all, thanks for having me. As mentioned, I'm the co-founder and CEO of Particle Health. We are an API middleware that sits between EMRs and third-party systems that need medical data to make decisions. So whether it's a doctor, a telemedicine app, or a payer, we kind of facilitate a secure exchange, finding that individual's records and then passing them back all through an API, kind of a RESTful JSON modern API. So it's we abstract a lot of the old school integrations that a lot of the EMRs have implemented and haven't changed since the MUMPS days back in the 80s and 90s. So that's kind of what some of our value add is. But what's interesting is there's two new rules that have kind of passed through the through the U.S. Government over the last couple of years. The older one being TEFCA, which is the Trusted Exchange Framework and Common Agreement, which is establishing a framework for how organizations should be exchanging data throughout the United States. It's built on trust, but it still adopts some of those same principles that Jennifer was kind of referring to earlier, which is the data is federated. There's no central government body, aggregating all the data. It's all in its silos, but it mandates and outlines a way to exchange that data in a safe way, which is also opt-in. And also it's also opt-out a little bit depending on the use case. So in the US, treatment, payment, and operations, also referred to as TPO use cases, are covered by HIPAA if you're exchanging with a HIPAA-covered entity. So if a physician is requesting a record, or if a payer is requesting a record, there's different rules than if a consumer application is and it's coming outside of HIPAA, right? So there's some kind of interesting nuance there, but as it relates to contact tracing, these frameworks that have been around for a long time and are exchanging millions and millions of records a month already are looking to adopt new use cases. And obviously one important one is the COVID-19 electronic case reporting and contact tracing use cases. This framework doesn't necessarily solve the problem of how do we track who's been in proximity with who, but it does solve the problem of let's make sure that these lab results from this person are accurate, or let's confirm that this person is, been to a doctor in the last, couple of weeks. So there's a very vital piece of the puzzle that these frameworks do solve, and have been solving really for a long time. So I guess I'll stop there and hand it back to you, Rita.
It seems to me, though, we have a life cycle issue here. So at first, we had the reaction to the fact that other places in the world were having a pandemic, and we could see it coming, right? Whether it was other parts of the globe or even other parts of the country. And so the reaction was, let's all just stay home and avoid interacting with each other, avoid crossing borders, avoid even going, to get your haircut or the grocery store. And so some of the technology that was deployed initially was just to make sure people were doing that. Not that they weren't sick, but that they were staying put. Rachel, thoughts about starting at the beginning, the avoidance phase, the lockdown phase, and government reactions and public policy reactions to that, all the way through what Troy is saying, which is, oops, too late. You're in the healthcare system because you've either been tested or you are ill. And it seems to me like we have data collection and data analysis and sharing all along that spectrum, and therefore privacy issues. Some of them are the same, but some of them are actually slightly different, especially when we're enforcing lockdown. What sorts of issues have you come across, and what are the technical responses that you've seen?
Absolutely. Well, I mean, I think at the beginning of your question, you mentioned that, initially the lockdown was enforced or put in place so that way people could stay put, not come into contact with one another, and thus reduce the risk of the virus becoming transmitted across people or populations, especially in dense cities like New York City, population dense cities, that is. So so you run into the issue of, are we collecting data to enforce behavioral standards, or are we collecting data to trace the virus? And I think the former scenario is contested heavily, because it runs the risk of infringing on one's civil liberties, the liberty to move, the liberty to be free from surveillance. And so, you know, it gives that impression. And then also, I know at the beginning of the pandemic, there were some critics of the term social distancing. Some have said that social distancing is not the right term. It's physical distancing that we want. We need to stay socially connected in order to effectively maintain our mental health, our sanity, maintain our relationships with one another, and quite frankly, communicate in ways that we need to in order to continue to eradicate, you know, the virus in the quickest way possible. So anyhow, going back to the privacy implications, the former scenario that I described is what's debated. Now, with regard to the latter scenario of connecting all of these systems so that way health information is exchanged in a way that's actionable for both public health authorities, for individuals and their families, their physicians or the clinicians that they see as they manage their own health conditions among the pandemic, in addition to the coronavirus. You know, those privacy issues and implications were already there around data interoperability between systems, as Troy mentioned, what his company does. Those issues were already there. I think what the pandemic did was probably augment the visibility of that issue for many. Only a niche of folks were talking about the interoperability issues, the privacy implications to health records being available on through apps on smartphones, individuals being able to consent to various uses and exposure of their protected health information. And I use that term as it's defined under HIPAA. So again, the pandemic just kind of forced us to take a harder look at all of this, and what probably was more of a passive or casual discussion before the pandemic has now become a forced discussion, because now we need to, or we have visited the need to implement digital contact tracing in ways that are that haven't been explored, quite frankly. Contact tracing in and of itself is a 100-year-old mechanism to monitor the spread of a virus, but digital contact tracing is something new. It's unfounded. It's the evidence base behind it is not there yet. The adoption rate is not there yet, as we mentioned. So now we've run into the issue of, is it smart now to rely on digital contact tracing as this sort of panacea, even though we don't have the evidence yet to suggest we can or that we should do that? So now, again, we've run into, the question, now that we have these technologies at our disposal, what should we do to understand how useful they are, and how should we do this in a way that's privacy preserving, and in a way that does not make individuals feel that their civil liberties are being breached or minimized. So I'll leave it there. I'm pretty sure that sets us up for, more discussion, but those are some things to think about. And those are some things that everyone has been saying since March, when the pandemic hit the US and when the lockdown occurred, to today.
Well, I have lots of questions, and I think I'm going to try to frame one that is broad enough that all four of you can jump in. As I think about this, I think, okay, the smartphone is a consumer device, so an app is delivered to potentially almost everyone, because so many people have smartphones, and everyone on the planet is potentially affected by this public health issue. It's not isolated to geography or even a population. So all of a sudden we have, down to the individual level, the question about whether or not you participate in this data collection and sharing regime. Then you have the creators of the app, or whoever's hosting the app, and then all of the players, what software is embedded in the app, and with whom the data gets exchanged, if anyone, and what the data is that gets shared. Is it personal information, or is it just the fact that someone was in this location at this time who later tested? And is it a government entity that collects it, or just the business entity? All sorts of issues about who collects it and shares the data, and then what happens to it. So part of the question here is there's myriad privacy questions. There's a lot of opportunities along the way to address the privacy principles, but do we have a framework to work with when we're talking about something that's deployed at the consumer level potentially, and not just on the healthcare institutions themselves? Or maybe put differently, are there multiple frameworks that we have to think about as we work through this problem? And it's not just one system, because there are lots of regulations in place. So Naomi, I'm going to pick on you first. Can you help us get started? And then I think Jennifer, it'd be great to hear from you too. Where do we start? Where do we get oriented? What laws and regs apply? What should businesses be? Where should they be looking for guidance? What should consumers be thinking about? Where do they go for help in figuring out how to navigate the privacy issues here?
Yeah, so that's very comprehensive. But I'll start by saying, so at NIST, we recently, or this past January, released a privacy framework, which is modeled after and complementary to our very successful cybersecurity framework. And it's really intended to help organizations identify, assess, prioritize, and manage privacy risk with their systems and their products and services. So it's pretty comprehensive in terms of moving from sort of how your data processing the data to sort of governance issues around what kinds of laws may apply to you, excuse me, and then moving on into sort of the policies and technical capabilities that you might want to have to help protect privacy. And so we've actually used the framework ourselves in terms of helping our, we've been designing a highly privacy preserving protocol for exposure notification, which I see a lot in the chat about, terminology. And I think we sort of align better with that terminology, because if you're really going for, high privacy, this isn't really contact tracing. It's more about a way to, enable people to learn when they might have been exposed to someone with a, positive diagnosis. But if you want high privacy, it's not going to be able to be used in the same way as manual contact tracing, where health authorities or someone can actually find you and talk to you about, okay, now you need to go get tested and self-isolate. Those are steps that people would have to sort of voluntarily take. And that's, going to be a trade-off between privacy and sort of, utility or effectiveness of the, response to the pandemic. So I think those are all really important questions. And I kind of want to go back just a second and make that point, because I know this is a technology panel, but and I work in the information technology lab, but I also think that we shouldn't look at technology as sort of this, silver bullet that's going to allow us to do everything more efficiently and cost effectively, because there will be these trade-offs between privacy and utility that we might not be prepared to make. And so, we really need to think about, the investment that we want to continue to make in manual efforts like contact tracing, and see how technology can support that. But it's not going to be, I don't think, at least in this country, it could be a replacement for that.
Jennifer, I want you to jump in on this. NIST's framework is designed for the organization. If the organization's following the framework, presumably there's also some room for balance and for trade-off. How do consumers think about this, and where do consumers go for help navigating privacy issues?
Right. So it's a great question. I want to back up for a second. and just add to a point that Naomi left off with, which is that, and that everyone has basically said so far, which is that technology is not the silver bullet, it's not the panacea, and that it can help facilitate in certain ways, and we have to be careful about how we do that, and that in particular, digital contact tracing is not going to be a one-for-one substitute for human contact tracing. Just want to add one other piece to that, which is that none of this really works particularly well without testing. And we haven't really talked about that yet, but testing is an essential element for any of this to be effective. And so we need to look at these systems as a whole, and at least in the United States, we still have not gotten our testing capacity and speed up anywhere close to the levels that even if we had the most effective contact tracing system in the world, it would be particularly as effective as it could and should be. So I just wanted to start with that. In terms of where, in terms of the legal regimes that apply and the policy frameworks, I mean, I think here too, it's important to think about who is doing the testing and who is doing the mandating, who is doing the contact tracing. So obviously, if we're talking about a government mandate, government required contact tracing, or even government surveillance as a means of facilitating contact tracing, and this is not something that the U.S. has done yet, but it's something that other countries have done, where they have collected cell phone data and other location data, which they then use to go and notify individuals about who they've been in contact with. That's all governed by the Fourth Amendment, and we can get into, if we want to talk about that, we can talk about the many exceptions to the Fourth Amendment and doctrine that might allow the government to mandate certain types of surveillance in support of public health needs that could but have not yet been implemented. So that's one set of legal rules that apply. When we're talking about consumer privacy protections, I mean, unfortunately, I think we have a dearth of, at least on the federal level, protections in this area. There have been a couple of competing bills that have been introduced in Congress that would, they're COVID privacy bills. They seem to be not moving forward at this time for a variety of different reasons. But the bills, I mean, the effort is to put in place limitations on how data that is collected pursuant to a range of these systems can be shared, with whom it can be shared, to what extent can it be shared with advertisers. These bills attempt to say, no, it can't be, and also limits on retention and other forms of dissemination, competing views about whether or not there should be a private right of action so that consumers can sue if in fact the obligations are breached, and competing views about whether or not federal law should preempt what in some cases is more progressive state law on these issues. In terms of where consumers go, which is I think what your question was, I think that's it's challenging. Consumers, there's a lot of burden in our system right now on consumers to educate themselves and to, in a whole array of areas, not just in this area, but because of the absence of comprehensive, effective federal privacy law, we have really put an enormous burden and a really unrealistic burden on consumers to do the kind of education and even just make the constant opt-in and opt-out choices that most of us don't have time to even really educate ourselves on or even know what we're choosing, because these things are really quite complicated. So I think in an ideal world, we would take the burden off the consumers and place the burden elsewhere, and that's where we should be moving towards.
Yeah, personal story. I took my young daughter to get tested because she had a really high fever, and she's fine, by the way. It took 7 days to find out. I'm seeing in the chat that testing is not very effective unless you find out quickly, although we kept her away from others till we knew for sure. But, I agreed to everything over the phone. Like all at once, someone said to me, oh, agree to HIPAA and all of our terms and conditions. And then pretty soon I'm in some other third-party company logging in to find test results, and who knows who they share the data with. So Troy, once you're in the testing system, and I think that's where most of this conversation will go, is beyond the location tracking of making sure you're following a quarantine or a lockdown, but you are now into the course of providing your health data, you're seeking a test, seeking results, being part of the testing system, positive or otherwise. Troy, what are the privacy regimes and frameworks in place now for health data post-collection that you work with? Tell us about that, and then we'll talk about the effectiveness of these systems.
Yeah, we work with all of them, so it's complicated. The history of healthcare data privacy is a complicated one, right? It goes back a long time, but I think the big kind of start was, I think, Clinton era with HIPAA and the privacy rule that basically established the right for the patient to have access to their data, but it's specified by fax because that was really the only way you could do it, by fax or mail or in person. And what ended up happening was around Bush W era, they had to kind of figure out how to do this in a better way. So what they established was a new rule in the US called meaningful use. And that rule basically said that if you're our provider or electronic medical record vendor, you have to have a patient portal, which is like a website that you can log into to get access to your data. And they incentivized providers, and they said, if you can get, I think it was 50% of your patients to log in and use their data meaningfully, hence meaningful use, then you get rewarded, you get paid. And they ended up having to drop that 50% target down to 1%. Because they couldn't get people to log into their portals. They didn't remember their passwords. They were bulky, poorly designed flows because everyone just adopted whatever they could to meet the requirement. So it didn't really work that well. And today, now we're kind of left in this world where if you're a patient and you have a test result somewhere in the system, how do you get it? The portals don't really work. The fax machine is archaic. Calling them and asking for it doesn't work. Even going in person to try to get your stuff doesn't work. So it's a really bad place to be in terms of, I have the right to my data, but I can't get it. And everyone hears the stories of how difficult it is to get their medical records. Joe Biden is a great example of when his son had the glioblastoma and was going hospital to hospital. Even Joe Biden, acting vice president of the United States, could not get his son's records from hospital A to hospital B. So if the vice president of the United States can't do it, that's an issue. So what happened was, just in March, a new law was passed called anti-information blocking. And the purpose of it was that these electronic medical record vendors like Epic and Cerner and Allscripts and Athena Health, because it's a privatized system and not a centralized government one, it's truly no one's fault when you're talking about a giant corporation, but they're incentivized not to share that data. They want to hold it and use it and sell it. And that's the way the system is set up. So that's the way they're going to do it. So it's now the new rule forces them at large penalty, it's going to get up to $1 million per infraction, to have an API I'll say it in a second, to share with patients and third-party solutions. The API stands for Application Programming Interface, and it's a secure way to share data for developers to build on top of. The same thing happened in banking just over the last, 6 or 7 years, right? We saw Bank of America and Wells Fargo and all these banks in the US, they didn't share information. A company came along called Plaid. They just sold a Visa for like $5.5 billion, insane amount of money. But the reason they were so valuable is because they did something really tough. They got the banks to share data, and they created a unified platform for third parties to build securely and safely and to share that information with consumers. And what's really cool about that is now we have things like Venmo and Mint and Robinhood that are democratizing, usually pretty established innovations. Usually the average person can't go invest in stocks. But with Robinhood, you can invest in a large stock with $5. You can buy a piece of an Amazon stock, right? That's a huge win for people, the average Joe. And our theory, and that's why we're doing what we're doing, is the same thing can happen in healthcare, where you can build a safe and secure way to share data with third parties, contact tracing or whatever, that really democratizes and takes the power away from the EMRs and the large payers and brings it to the innovators and the people. So it's kind of an interesting transition since the old days, and it's a long, complicated history, but it seems with the passing of this new rule back in March, it really starts to get enforced in 2021. There's optimism in the future, at least.
So Rachel, what are we talking about in terms of where we would turn for law and policy here? I'm hearing, we have HIPAA for the healthcare privacy space. We have state consumer protection laws like the California Consumer Privacy Act, which is not unique to any sector, but we still have at the US federal level mostly sector-specific privacy laws, and not, as Jennifer pointed out, a comprehensive consumer privacy law. Do we have enough law here? Or are we mostly looking toward voluntary framework systems like what NIST is urging companies to follow?
Yeah, so that's a great question. And Jennifer also mentioned that there have been a few bills introduced around digital contact tracing. So quite frankly, the answer is no. We don't have a comprehensive privacy law, as you mentioned. We don't have, in terms of laws, that have been passed, we don't have any sort of legal framework that we can rely on currently for digital contact tracing. We only have the patchwork of state laws that are meant to cover or govern the privacy elements of manual contact tracing, really, not digital. So maybe there's some applicability there within those laws to digital contact tracing, but quite frankly, digital contact tracing introduces an entire new set of concerns that people have that spill over into a lot of the concerns that Troy just mentioned, Jennifer, Naomi, everyone's mentioned here, that were already inherent to the use of mobile apps to share data, to share electronic health record information. All of those concerns are now spilling over into digital contact tracing. And so again, no, at this point, we can only rely on the patchwork of state laws and legal frameworks, best practices that are out there currently, the NIST framework. I mean, it's a puzzle that everyone now is challenged with piecing together until we get something comprehensive in place. Some, as Jennifer mentioned, and as I just did, some bills have been introduced, but they haven't, they didn't really move. They haven't been passed. So I think, it could be because we're still trying to figure all of this out. But I think the overarching concern around all of this is that by using these apps, by creating these interoperable conduits of information, there's a risk for information to be used in ways that go beyond the original scope or intent of the data collection or the federated data exchange mechanisms. People are concerned about that, and that's probably why the adoption rate for these apps are so low currently. So until we start asking the right questions, and until we start coming up with ways to address real concerns and creating a legal framework or structure around that applies to everyone, then I think only then we'll be able to make people more comfortable with using these apps in the ways that they're intended.
Naomi, Jennifer mentioned at the beginning some of the issues that are raised, privacy issues that are raised by, let's just take contact tracing apps, for example, deployed, the digital ones, not the manual ones. The fact that you have to decide to download it in the first place, that it may ask you to opt in inherently, that the data could be shared either centrally with a database, like a massive shared database, or with a governmental entity, or it could be held locally. There's a technical choice between Bluetooth connections with other people in your location versus GPS, which is location specific. So there are privacy choices that can be made all along the way, either institutionally or publicly, or by the developer of the technology and all of the players in the mix. And I always want to emphasize, there's never just one player, is there, that develops the app, collects the data, and makes all the decisions. There are so many different business and governmental parties potentially involved in any of these tech solutions. Naomi, what does the privacy framework offer organizations that are participating in the collection of and the processing of health data, depending on their role? How would you deploy the framework if you're one of those organizations?
Yeah, so we definitely designed the framework to be used from sort of any role in what we call the data processing ecosystem. So I can give you an example of how we used it. And we've been looking at these digital contact tracing or exposure notification apps in a more limited community to sort of one, address some of these potential uptake issues, but still get the value, right? So if you're in a workplace or a school, those are some of the places where you might be having high contacts with people, outside your household. And so there it could actually be very helpful. And so we really looked at the framework, and we sort of went through and said, what are the most priority activities? And one of the things that the framework offers is, certainly we looked at laws and, whether we are a HIPAA covered entity, and in general, we are not. But, so we were able to sort of look at that and analyze that, and then think through what kinds of policies do we want to have on data retention, as you said, and what the information can be used for. But beyond that, we looked at the sort of technical measures, and we looked at some of the privacy preserving protocols, and we had some concerns that there were still vulnerabilities to sort of like third party correlation attacks, and so we have a category called disassociated processing, which is really about sort of how do you sort of disassociate individuals and their information from each other. And so from that, we could say we can actually really apply, pretty standard cryptography to really anonymize these interactions, and even, shut out some of these sort of third-party correlation attacks. And so, we were able to go through this entire process and, come out with this very privacy-preserving protocol. If you wanted to expand that, then yes, you would definitely have to sort of begin to think about the contracts and the frameworks that you would need with additional parties. But we sort of think that this could be kind of a standard for some how it might be work in other domains.
Cool. Sorry, struggling to get myself off mute there. Troy, how would you improve upon the frameworks that you see in place right now, from a data sharing perspective, from the consumer's perspective, and also from, as you clearly, your point of view is that there should continue to be innovation in the data sharing opportunities, and you seem to think there's privacy value to that. So tell us more about that.
Yeah, I mean, I think if you look at the balance of ownership over your data to privacy and security of your data, I think we tilt pretty hard towards privacy and security and not a lot of ownership, which is okay. It's the safe way to do it. But I think people are demanding more access to their information. Every year, it's more and more. So I think it's a good thing that we're headed in the right direction. It's just a question of how. And so that's kind of where we are today, and lots of conversations about the how. There's a few areas in which I think the industry is kind of trying to figure out how to open up access to data a bit more for the consumer. If we're going to do it in a digital world, it has to be digital. So we have to have technology allow us to do a couple things. One is we have to accurately capture consent or authorization from the individual, and we have to be able to represent that to a system of stakeholders in an accurate way. It's a complicated thing because you can get very granular about blanket consent or specific consent for very granular things. So it's pretty complicated. There's a few ideas out there around a thing that we call instance-based consent, or authorization. So if you downloaded an app, you just give that app permission only. So it's not like a theme of permission. Like I give my permission for all of research, but it's just a specific entity. So the authorization consent thing is something people are still trying to figure out a little bit. The second one is identity attestation. The US does not have a unique ID for every person for the health system. This has been a hot topic in the government for a long time. It's passed through the House a few times, but it gets stuck in the Senate for, I think, like 20 years. I know like Rand Paul and Rand Paul's father have been lobbying against it and filibustering against it for a long time. They have good reason though. And the reason is if this does get passed and there are unique identifiers, the government can use that for things like law enforcement, to look at your medical records, to trace for crimes, which is in a lot of ways, and I'm sure would be used as a breach of security and privacy and liberty. So until that gets sorted out, I don't think the United States is ever going to have a unique ID for people in the healthcare system, which means that if we want to have a truly interoperable healthcare system, we need to have a very accurate way of matching people's identities to their accurate records. Until we have that system, there's no 100% certain way to find Bob Smith's records across the United States. There's too many Bob Smiths. They all have similar birthdays. How do we know we're really going to give the right record to the right person every single time? Because if you give the wrong record to the wrong person one time, you messed up. That's bad. It's not worth it almost. So this is kind of where we're headed as an industry, which is we kind of jumped off the cliff already, passing this rule back in March. And now we're trying to assemble the airplane as we fall. And we better build it before we hit the ground. It's a scary analogy. I mean, people have done this over and over again. I think time is a great incentive to get things done. So I think people are going to figure it out. But you got to figure these two things out. One is authorization and consent. Two is identity attestation. The rest of it is more or less figured out. We follow NIST guidelines for the IAL scoring for identity attestation. So there's some really great guidelines there for the industry to use. There's a few vendors out there that do it really, really well. So it's really a couple things left on the checklist to figure out before we really get to the next evolution of healthcare data exchange.
So Troy and Naomi, thank you. I'm hearing there's frameworks for organizations to follow, privacy by design for organizations to follow, even some legal structures in place for the health industries to follow. But what about the government? A lot of the questions in the Q&A have to do with government access to this information, whether it's the US government or any other government in the world, since these apps are, of course, being deploying all over the place. And the trust issue, the overarching trust issue. So I'll start with you, Rachel, but Jennifer, you're up next. What are your thoughts on the data sharing trust issues with governments? And sort of what's the state of affairs right now on data sharing with governments, and what should we be thinking about going forward? What are the implications of those trust issues?
Mm-hmm. So one thing I want to point out that I kind of wanted to point out at the beginning of our talk here, that the Apple Google APIs are only available to authorized public health authorities. But although they can use these the API for apps that they develop, the data is not collected and centralized in any way. It remains federated or on people's phones. So that way they receive notifications about with whom they've been in contact in the event someone they were within close proximity to tested positive for COVID. So authorized public health authorities are usually local governments that are implementing measures at the local level. So I do want to point that out. And in addition to what everyone has shared, I also want to say that specifically with regard to digital contact tracing, I think we're trying to move into what we are thinking about conceptually, moving that into a more procedural format, more of an action plan. So I'm happy to share that there were, share in general, two frameworks, one of which was introduced or disseminated just this week among the Future of Privacy Forum and a company called Bright Hive, we released a new digital contact tracing playbook that contains a checklist of actions that organizations like governments who are deploying these apps, steps or actions that they can take to ensure that the privacy concerns and risks when implementing digital contact tracing are mitigated. So I encourage folks to take a look at that. It contains a list of key things to consider and a checklist of items that one can take to take action on those considerations. And I also recommend a book that was published just in May by a group at Johns Hopkins called the Johns Hopkins Project on Ethics and Governance of Digital Contact Tracing Technologies. The book is open to the public and it's available. I have a couple of links I can share to both of these tools with everyone if I'm able to. But again, they're publicly available. And what I really like actually in that particular book is one thing that was mentioned that I think a lot of people aren't necessarily talking about, but some bills have talked about in some ways, at least at the governmental level, is that in the book, and I quote, they say, making access to life-saving healthcare contingent on using a digital contact tracing app or making valuable disease information available only to app users, it wouldn't be ethically appropriate. And that using these incentives as a way to overcome ethically unjustifiable technology design, such as using incentives as an offset for providing personally identifiable health information to other users, designing incentives around that is unethical. One shouldn't be incentivized to give up their privacy in some way, as a way to, or rather, in addition to being coerced, or as a way of coercion into using the app. So I think that's something that resonated with me that a lot of people haven't necessarily talked about. So although these apps can be useful, there are a set of ethical elements that everyone should consider. And I think both this book and the playbook that FPF and Bright Hive put out, it really goes deep into a lot of the ethical issues around what should be done procedurally, versus conceptually around all of this. So all of those guidelines are meant for governments to consider, for individuals to think about, and any other stakeholder really who's trying to really grapple and digest all of the ethical and privacy implications to implementing this technology.
Jennifer, it's cultural though, isn't it? I mean, in Europe, we have the General Data Protection Regulation, very concerned about individual privacy rights based on human rights as the foundation of giving individuals the right to control their own data. And yet we also have restaurants collecting people's data when they come to, have a cocktail at the end of the day so they can help with the contract. They're all pitching in together on the contract tracing effort. What do you have to say about balancing cultural perspectives on privacy and civil liberties and human rights and the role of governments in protecting public health?
Right. So it's a really great and it's a really hard question. I mean, I think one of the things that's been so interesting about kind of watching some of this unfold is that it's turned upside down a little bit some of our assumptions about privacy and privacy protection. So, as Rachel just mentioned, the Google Apple system is explicitly designed in a way that the data, and several other people have mentioned this as well, the data is federated, it's decentralized, it's stored on individual phones, it's not collected by governments. It was really, a number of European governments really pushed back on Google and Apple and really kind of called them out and said that they were designing a really ineffective system, that they wanted to be able to collect the data. And not only did they want to be able to collect the data, they also, a number of governments were frustrated by the fact that, as we mentioned very early on, that the Google Apple system only works with Bluetooth technology and doesn't also track location data. And so you see this really interesting kind of upside down system where Europeans who, as you just pointed out, have taken the mantle of privacy. A lot of European governments were actually pushing for systems that were arguably much less privacy protective, at least, than the big US tech companies were pushing. And so that was one really kind of interesting issue. The question about government access and what kind of controls apply is a really country by country specific question. So as several of us have alluded to already, in several countries, there's been really a government centralized system. Singapore, some of the Israel systems, a range of other countries in which the government's collecting data, using that data to notify individuals. In Hong Kong, for example, the government does a public mapping of individuals' movements after somebody's tested positive, and others can go and look up where people have traveled over the last 14 or so days prior to being tested, to having a positive test. That's a government-run, government-controlled system. There's been some comments about this in the chat as well. That's led to, in a number of different instances, some real harassment against particular individuals for a variety of different reasons. So that's one system. In the US, as we've said before, there hasn't been this kind of centralized government system, at least on the individual level. And if there were such an effort at collection, it would raise or a government mandated contact tracing system in which the government collects all the information, at least on the federal level. You get into interesting, I think, Fourth Amendment questions there as well. That said, going back to your initial question about trust, I think that there is a perception that this data, once it's collected, even if it's decentralized, it becomes available, and there's a risk of government access and government collection. And that fear and that sense that this potentially sensitive information can be accessed and could be used for other means is one of the things that's driving the low uptake rates that makes these systems less effective than they otherwise would be. And I'm just going to hammer home the point that I made earlier, because I think, again, none of this works without testing, and we need better testing.
Yes, agreed. I agree completely. Troy, what is the role in your experience of the contract, agreements between parties to behave well, to exchange data responsibly? Are you finding in your practice that that's a big part of the ecosystem of data exchange, whether it's between private entities or private entities in the government?
Yeah. So through TEFCA, the framework that we're building on top of, and the ONC is essentially rolling out right now, the T stands for trusted. So there is a element of trust at the core of these networks. As it stands today, we are not allowed to share data with any non-HIPAA covered entity unless we've gone through the things I was talking about earlier, which would be the authorization and identity attestation steps. So 99% of the time, we're sharing data with a hospital, a clinic, a lab, a nurse, a pharmacist, that is a covered entity. So the data remains within the bounds of HIPAA, and it's a pretty safe kind of framework if you're sharing data in such a way. In order to share data outside of HIPAA, we have to go through those extra steps of identity attestation, and which is following a NIST guideline, and the authorization step, which, as I mentioned before, is still getting worked out through the government and through the standards working group. So as far as it stands today, it's pretty safe. These are organizations that already share data by fax machine 99% of the time. So we're not inventing a new flow of information. We're just substituting an archaic one. We hope to move outside of that soon enough. But again, we want to make sure that we're doing it right.
Well, one of the questions that came up early in the Q&A, and it's where I'm slowly, I hope, leading us, is recently, as in last week, there was a decision from the European Court of Justice that invalidated a system of data transfer between the US and Europe or I guess I should say differently, transfer from Europe to the US is better put, based on this program called Privacy Shield, which was the US government, the Department of Commerce, creating a mechanism for US organizations to promise to participate in a voluntary system of making promises to the government that they would be responsible with personal data coming from Europe. So it's a classic American, US-based way of agreeing to be good stewards, to voluntarily promising to follow privacy guidelines and privacy principles. And if you don't live up to your promises, then there are consequences, enforcement consequences, self-regulatory, opt-in, voluntary systems that have enforceability from, in this case, the Federal Trade Commission. That's been a large part of our privacy regime, I would say, in the US, as well as private agreements. So if you look at HIPAA and its system of binding by contract business associates, if you look even at the Gramm-Leach-Bliley Act, similar situation. Frankly, even GDPR has built into it this idea that data is transferred down the line with promises built in that everyone will follow certain safeguards. And then you're really in an enforcement of promises game. But some of that is a part of our inherent trust system. When we give our data to an entity, we expect them to promise us and then promise each other all along the supply chain to be responsible. Naomi and Jennifer and Rachel, all of you, start with you, I guess, Jennifer, is this system of promises, which is also still in place because these standard contractual clauses, which are contract provisions that are still possible to have in place for now anyway, are again still contractual promises between parties. Are we most of the way there with our contractual regime, as well as our system of saying what you're going to do and then living up to your promises, the privacy policy? Is that enough trust for the moment in the system where we have to move quickly?
Right. So I think there's a lot of different issues in there. So one is, how much can we rely on private agreements and private systems? And I think in the absence of strong and effective regulation, that's all we really have. But in terms of the Privacy Shield, I mean, the issue, so I think the implications of the Privacy Shield ruling are even broader than Rita, you just suggested, and that the issue is less a lack of trust of the companies keeping their promise. The issue the court had a problem with was the US legal regime, and particularly its intelligence surveillance system, and a sense that under US law, it doesn't matter what kind of commitments the companies make, that under US law, the data that's held by or transferred back to US companies could be subject to foreign intelligence surveillance, and that in the European court's view, foreigners do not have sufficient rights vis-a-vis US intelligence authorities. And that affects both transfers under Privacy Shield, and it also seems to effectively nullify the ability of companies to make similar transfers pursuant to standard contractual clauses, because under the court's ruling, the companies now have to basically verify that the US system offers sufficient protections that are equivalent to the protections that the European court deemed apply in Europe. And given the court's ruling about foreign intelligence surveillance laws, it seems almost impossible that companies would be able to do that. And so it's really kind of like caused everything in terms of transatlantic data flows on the private sector to be turned upside down. There's been some questions in the chat about how that affects contact tracing. And I think, at least with respect to contact tracing, I don't think there's a huge implication, because first of all, most of the contact tracing is going to be more local. So unless you're talking about transatlantic travel and tracking where people are moving across borders as they travel transatlantically, you're not having as many data sharing issues. And right now, most transatlantic travel is largely shut down, not completely. But there's also, it also does not affect, and this is important, it does not affect government to government sharing. So to the extent that there's law enforcement to law enforcement, or or airplane to public health authority, information about manifests and all that, that won't necessarily be affected either, because we're talking about different systems there. So really, the Privacy Shield decision is huge and has massive, massive implications, and may have implications for sharing of data for public health research purposes. But in terms of the contact tracing apps that we have been primarily talking about, I'm not yet sure that it has a huge impact.
Rachel, what are your thoughts on the system of the network of voluntary promises, often of which are backed up with enforcement? So the American way that we have right now, and I guess the next question, because we're running low on time, is what do you predict will be coming next in terms of positive law or state law?
Yeah, well, I am seeing a trend of beyond the promises and contractual obligations and terms, floating around in a very piecemeal manner among companies. First, I must say, FPF, we are at the forefront of getting companies to make, public-facing promises. So definitely a great appreciation for that process, and I do see value in that. But I think at the legislative front, we're seeing some bills introduced, particularly around data collection for vulnerable populations, like, for example, African Americans who have been disproportionately affected by the virus. We're seeing a push for data collection to better serve those communities. Now, as it would apply to digital contact tracing, since, for example, the Google Apple API is a decentralized, exposure notification service, that does not collect data or allow public health authorities to collect data in a centralized way, I think now we're kind of forced to look at that particular component of the technology as more of an intervention versus a data collection solution. So, as these bills are introduced, or as we think about how to make or how to increase trust, or how to foster trust between companies and app users, I think we're forced to say, all right, with the tools that we have and with the data collection mechanisms at play here or at our disposal, how can we collect some sort of data to look at the effects of this exposure notification API in terms of its ability to motivate behavior around physical distancing. For those who don't use it, what does that look like as well? And how can we collect data around that in a way that better serves high-risk communities? So again, I think we're challenged now to think smart with what tools we have in front of us. And rather than looking at the Google Apple API as sort of, the panacea or the solution to all of this, it's rather just a tool that can reinforce the way we do things, or the way we can analyze physical distancing behavior, for example. So we are seeing some more intentional data collection regimes that are backed by legislators, enforced by public health authorities who are really trying to get a handle on things, especially in southern regions that are seeing a spike in cases. I think, I don't know what they're doing, but I would hope that, they're taking advantage of these tools in ways that can, hyper serve the communities that are most affected by the virus, and also in ways that improve public health services that are already available to individuals that need it. Social safety nets, a lot of people need that right now, given the effects of the virus on the economy, on our education system, and so forth. So as long as we can make promises or create contract language and provisions around in ways that are reasonable or meaningful, and also practical with the tools that are in front of us, so that we make sure we're not over promising, or to make sure that we're not saying that we're going to do something and it creates a privacy risk or a privacy concern, I think that's what we should be doing right now. And I think that's what a lot of people are starting to realize, legislators included, at this point.
We only have a few minutes left, so I'd like to go around the room and have each of you give a closing thought on what are the lessons we've learned from this that policymakers or organizations, you can address whomever you wish, should take away going forward when it comes to privacy, public health, and technology. Naomi, I am going to call on you because we have not had as much time from you today as I'd like. So you get to tell us what our biggest takeaways should be from lessons learned.
All right. Well, I would like to see better alignment between technologies, privacy risk management, and the impact on public trust. So I think one thing is an issue is that, privacy is not binary, right? Insofar as we either have it or we don't have it. It's really a spectrum of trade-offs with, sort of desired interactions with others. And so we really might improve public trust if we approached our implementation of new technologies with this understanding. So, just sort of take this whole discussion about these exposure notification or digital contact tracing apps. So, we call something privacy preserving when we talk about the Apple-Google protocol. But there's really sort of insufficient due diligence as to what that means in terms of privacy gains and limitations on the spectrum of trade-offs. So, if we had this discussion, then implementers would, would be better able to decide how to address the limitations in ways that meet the needs of users. But I just saw this recent news article that, sort of called out some latent location tracking issues with Androids. And governments that had been implementing this were now, really alarmed and upset. And it basically came out as this sort of betrayal of, public trust because it had been billed as privacy preserving as if it was like binary. We had privacy. And this, as I said, we've come up with this alternative protocol, which provides this different set of privacy gains. But it also comes with a different set of trade-offs. And so it's not really a question of one being objectively better than the other, but rather which one better suits a given environment and the privacy objectives of the implementers. And so having these informed discussions about these privacy differences and the associated costs and benefits would really enable better choices and more useful communications with the public and build that trust. So that's the point I would leave with.
Great. Troy, how about you? What's the takeaway? What would be your policy recommendations or what you'd like to see lessons learned?
I think there's two paths here. One, the ideal state is we have a healthcare privacy framework from the government. That'd be awesome if we had that. It'd make my life a lot easier. I think it would make everyone have clear understanding of what needs to be done. In the absence of that, I think there just needs to be a lot more transparency and clarity around things like identity management and authorization protocols. The US typically takes the route of allowing industry to create the standards. Government says you have to do this. Industry figures out how, and then some standard is adopted. If we want to do this quickly, then I think the government needs to stand up a little bit more and create that standard in absence of a combative, industry that tug of wars back and forth on things. So difficult thing, but that's what I hope for.
Great. How about you, Jennifer?
So I'll say two quick things, which is three quick things. One is that I think good health and good privacy should be understood as going hand in hand. That we've talked a lot about trust and trust being essential to people using the systems, taking advantage of the healthcare systems, trusting public health authorities, and that having good privacy helps with that, and it's really critical. Two, that it's incredibly important to look at these systems holistically. So if we just focus, and this is the point I've been saying over and over again, if we just focus on contact tracing and don't consider how it fits into the broader test, trace, treat, and isolate system, we're not really solving the problem, and it becomes a panacea that's not really a panacea. It's a false hope. And then third, I would suggest that in addition to better private health privacy law, we really need a comprehensive privacy legislation, because these issues, particularly the questions about how personal information is disseminated, accessed, and retained, are not specific to the COVID crisis. They are much broader than this particular crisis as well.
Thank you. Rachel, you get the final word.
Sure. So I second everything everyone just said, and I third it and fourth it. So I would say that, digital contact tracing, as I mentioned, it's a new, novel approach that, is contestably an intervention versus a solution. But we all have to understand that, for what it is, it lacks evidence, and we don't know about its ability to be useful for its intended purpose. And for that reason alone, given that, we lack evidence currently around it, there's naturally a dearth of operating protocols that we can use to, effectively control the pandemic using digital contact tracing. And so the approaches that we take today to determine its efficacy, its utility, I think that those approaches, that we take, that should probably be preserved. It's something we should do today. It's something we should continue to do. And essentially, we should do this in order to understand what, not just its utility, but also fairness in its design, privacy in its design, and iterate on that moving forward. And I think it's really important to do that, because there are some people that are, eager to use it. Our CEO here at FPF, he stated on LinkedIn publicly, that it's something that he would use. And I think people like him would benefit from having this information in front of them to understand what are the risks, what are the benefits currently, and how are we backing up all of that with evidence that we're collecting. So we need to be intentional about the information we collect. We need to know that this is not the end all be all, rather this is a beginning. And I really want to end by saying, and I can't caution us enough about this, but there's risk in creating or exacerbating social stigma, harm, inequities, you name it, as we think about implementing digital contact tracing. We should really think hard about this and consider it, because the last thing we want to do is incentivize uses of these kinds of apps that, may or may not be useful. We'll see. We don't want to incentivize their uses in ways that create the haves and the have-nots. A lot of people I've read on social media and the news, comments, you name it, everyone has saying that this virus is creating this sort of have-nots effect. It's not only exposing the disparities that were already there, but it's driving them in ways that we've never seen before, or in ways that we have yet to fully grasp or grapple with. And so if we're going to use digital contact tracing, and if we're going to, try to figure out how it can be useful and reliable, that needs to be equally met with policies that can protect against coercion, social stigma, harm, inequity, especially for vulnerable populations. And so all of that being said, as I said, I second, third, fourth, fifth, you name it, that strong privacy protection standards are really important, especially a single comprehensive standard. All of that is really important, just to make sure that whatever advances we make in using this technology, all of that is equally met with protections that are meant to steer us away from, our sins of the past.
Wonderful. Great discussion this morning. I want to thank you all, and thank you for having us for the Internet Governance Foundation. Back to you, Melinda.
Thank you so much, Rita, Troy, Jennifer, Rachel, and Naomi, for a really informative session on a topic that touches all of our personal lives. It's clear there's still a lot of work to be done here. So just a reminder, folks, we have a coffee break room, actually 3 of them open for you over the next 15 minutes. And then we're going to resume back here around 11:45, discussing what does artificial intelligence, machine learning, and big data mean for the internet. See you soon.
Actually, the next session starts at 11:30. So we actually only have a 10-minute break. I think we cut most of the people, but just wanted to make that clarification.
This is what happens when I don't follow our agenda and look at the clock.
That's okay. I thought it went really well. Thank you, everybody. I think a lot of people learned a lot today, just in terms of terminologies and the frameworks. And there were some who didn't even know what contact tracing meant.
I saw that.
So, yeah. So, I mean,